In the Coulee region, there are only 2 inpatient psychiatric units, Gunderson Health Systems in La Crosse and Trempealeau County Healthcare Center in Whitehall. This has decreased within the last decade with the loss of 2 previous inpatient units accessible to the community. On the other hand, in the Coulee region, there are 5 jails. Through research, we have identified that although there are some services offered for those with mental illnesses, there is great room for growth.
Common good is the good that we hold in common. And the good that we hold in common is the health and well-being of each individual person, each individual family, neighborhood, community, organization.
According to Laura Wallace, in the United States today, we have more mentally ill people behind bars than anywhere else, which in effect makes our correctional system the largest provider of mental health services in the nation.
We do suicide assessments, we do elopement assessments, sexuality assessments, we do head-to-toe physicals, we assess for phone safety, visitor safety, and we review this all and then call the doctor, review all their medications for safety.
But lots of times the mental health, they will just continue them. We also have a mental health counselor that comes in once a week. So if they come in and say, hey, I'm bipolar, I'm schizophrenic, or I have a lot of depression and stuff, I automatically put them on a list to see our mental health counselor.
Okay. The public stigma regarding mental health greatly impacts one's ability to receive care. This stigma also plays a role in adherence rates. To fully combat this, we as a society need to be more aware of this stigma and how it affects the common good.
That it's a chemical imbalance, that it's not somebody's choice, that there's treatment for it. If you know anybody, let them know there's help for it, whether it's calling an 800 number, whether it's, making an appointment with a doctor.
In both inpatient psychiatric facilities and incarceration facilities, freedoms are limited due to safety concern, and both individuals face demoralizing stigma related to their mental illness. However, from these interviews, it is clear that there is a lack of mental health assessment and promotion within incarceration facilities. In inpatient psychiatric facilities, assessment and mental health promotion begin immediately upon arrival. Mental health assessment occur up to a week after admission in incarceration facilities. Medication regimens and verifications also can take up to 2 or more weeks.
We each have the capacity, as friends, neighbors, family members, professionals, to make sure that we have a community in which people are protected, respected, and connected.
So from the police side of things, when we have contact with a member of the public who is in crisis, we have to make the determination of whether or not an emergency detention would be appropriate. The emergency detention would be for the protection of either that individual or the public at large.
Well, I think that mental health care is absolutely needed, and being the only hospital in town or in the area that provides mental health care, I think is extremely important, because we know that mental health care is not what we call a money maker at all. In fact, it's sometimes the opposite. But Gunderson has identified this as a need for the community. I think speaks tremendously to our values and to the mission and vision that we follow.
Be self-aware of your own bias and judgments.
Know the resources available to you and the ones around you.
Educate yourself and others on mental illness.
Advocate for mental wellness in your community.
Reduce the stigma around mental illness.